Hi, I'm Dr. Martine Sacks, and I'm a developmental pediatrician here at the Providence Neurodevelopmental Center for Children. A developmental pediatrician is first a pediatrician, and then we do extra training in learning how children develop through the years. Children who come to see us here are referred by their pediatricians or their nurse practitioners or their family practice docs. Sometimes they're referred by families who are worried about their children's development, or sometimes by other community agencies like early intervention. We see children of all ages for various problems with their development. So we see babies typically for things like they're not feeding very well, or they can't hold their head up, or they're not beginning to roll over. We see toddlers for reasons like they're not walking yet, or they're not talking yet, or they're very frustrated. We see older children between 3 and 5 because they're not doing things that their parents expect them to do, or they may not be ready for kindergarten. And then we see older children as well who are having problems both at home or in school. We look at the entire child when we're assessing a child's development, and we have this incredible luxury that we get to see you and your child for an hour. That's a long visit for you, and it's just almost enough for us to understand what's going on with your child. We're going to ask you lots of questions about your child's medical history and your family's medical history. We're going to want to know about the pregnancy with your child and your child's first few days of life. And we're also going to want to know what your child likes to do, how your child plays, what makes your child happy, how your child eats, and how your child sleeps. We put all this information together to try to understand what are the difficulties that your particular child is having doing their work of childhood. Are they having trouble walking? Are they having trouble talking? Where does that come from? Sometimes when we see children, we recommend that children go to see other medical specialists or have other testing done. And that might be blood tests or x-rays or MRI scans. Sometimes we refer children to the therapists in our program, like a physical therapist or occupational therapist or speech pathologist. And sometimes we refer children to other medical specialists, like a neurologist or a heart doctor. All of this helps us to understand your child better. It is a scary thing when you need to come and see us. It means that something's not going right. And usually by the time you come to see us, you're very worried. We do try to make the visits be very straightforward. We want to understand you and your child. A lot of times parents hope that we're going to give them the answer, the reason why their child is having trouble. And oftentimes we can't. What we do is we look at your child, we see where they're having trouble, we try to highlight what we can do to help their development move forward, and we try to find an underlying reason. Often we don't find one, but that doesn't mean that there isn't something wrong with your child, and it doesn't mean that there's not something that we can help to do better. Our job as a developmental pediatrician is first to evaluate your child and to make whatever diagnoses we can, but then we're going to stick with you and your child over sometimes years to help guide your child's development. What therapies does he or she need now? How are we going to help with school? How do we help you understand how to help your child communicate or walk or talk better? And those are the roles of a developmental pediatrician in working with families and children.